Hi, I'm Dr. Brian Lesage, and we're here at the Beverly Hills Institute of Dental Aesthetics. And what we'd like to demonstrate this afternoon for you is using Herculite Ultra on an anterior tooth, and hopefully share with you how its simple system of not as many shades as the Herculite XRV had, and its polishability, so the way it handles and its polishability will really simplify your life in your operatory. So what we'd like to do is just fix this very simple class 4 chip on tooth number 8 on Jessica. Very nice patient here. And it's very small, but sometimes the small ones actually can be difficult. So with that little intro, let me get started. Okay, so I've put your classic 45-degree bevel on here, and you're all familiar with that. And then I do what I call a starburst bevel, or some people have called it a scalloped bevel, but I like to put a little starburst bevel to try to break up the light. And then in this procedure, we'll be basically putting down one shade of composite, and probably just because she has such translucency in this mesial corner on tooth number 9, obviously the tooth that we're trying to mirror, I'll probably have to put just a little bit of a second shade there in particular for this case because of her translucency. So but let's see how simple and easy really this goes. I like to use a little plumber's tape just to protect the adjacent tooth. And so try to get that in there, not having any wrinkles or crinkles on it. And this is nice and thin. You can get this literally at Home Depot for $1. No, just one. $1.40 for like 100 yards. So very inexpensive, simple stuff to protect the adjacent tooth while I go ahead and etch. This is pretty much all in enamel, maybe a tiny bit of dentin. So we're just using, 33, 35, 37% phosphoric acid etch. And dentin we'd only want to etch for a minute. Dentin we'd only want to etch for 15 seconds. So dentin only 15 seconds. Enamel you can go a little longer if you're all in enamel for maybe 30 seconds. Is very safe. So just a nice etch. So I like to rinse the etch off very well. And now we'll use some Optibond Solo Plus. And actually, I'm glad I watched Edwin. Actually, he tore that out of the wrapper. And that's something very important. The etch, I hope you could tell that the etch pattern, I didn't point it out to you, but I should have showed you that the etch pattern was well beyond the bevel. And that's really important when you're doing these restorations, is etch beyond the bevel. And this material we can carry down a little bit beyond our bevel. And I say finish it to infinity. But you want to make sure that you open these wrappers up, okay, right on the spot. So don't open them up in your operatory and leave them open. Sometimes the assistants think they're being efficient by having them open up prior to using them, and that actually is going to change the chemistry a little bit. So keep them in the aluminum foil wrappers until you're going to use them. And I usually use 2 or 3 coats. So I like to use 2 or 3 coats, and you can watch that I am in fact rubbing, scrubbing, agitating. You choose the word. Agitation is what most of us probably put. That's the word in the literature most of the time would be agitate. And even though we're mostly, as I said, into enamel, we only maybe had a tiny bit of dentin exposed here, I still like to agitate this well. And so we get good adaptation, good flow into the enamel. Microstructure here, the etch pattern. So that was Optibond Solo Plus that we just used there. Now we blew that. So the Optibond Solo Plus is a total etch, 1 bottle system. So it has the primer and bond in it. And that's why you need to blow it. You need to blow the solvent out of the primer. I've put in the literature that I call the primer a necessary contaminant. I think that's a nice way of describing it because it's necessary, but if you didn't blow it, the solvent would be a contaminant to your bonding system. So a necessary contaminant is what I like to call the primer. So we've primed and bonded the tooth with one bottle. That's why it's a total etch one bottle system. And go ahead and light cure that. And now we're going to add just a very small increment of the Herculite Ultra. And some of the things that I hope you'll notice here is just how nicely it sculpts to the tooth. I'm using gentle touch, and how as I sculpt it, it stays where I've put it. And that's really, from a handling standpoint, that's what you certainly, I know all the clinicians are very aware, they're very aware that is what we'd like to have, is nice handling properties, but we don't want this material to slump. Give me just a little bit more. So you want to be able to put it, push it, get it where you want it, but then you want it to stay there. And that's the one nice thing that this Herculite Ultra does. Those that have used Herculite through the years, I've been a Herculite user for over 20 years, and Herculite is a stiffer material. And so you have to really push Herculite a little bit more, but it's still, Herculite has been on the market 25 years of proven technology, fabulous material. What they've done is put in some nanofillers in this, and hoping that because of the nanofiller particles in the Herculite Ultra, that borrowing from the same chemistry of Herculite, that will in fact have the great strength that Herculite has had through the years, but a little bit better handling properties, and a little better polishability would be nice, especially the maintenance of the polish. I would rarely today use Herculite on an anterior tooth, but certainly I use it on lots of posterior teeth. So this is, you can see that it's gone right where I wanted to put it. I'm extending a little bit off the edge, and it's just staying right there. So really nice quality, the way it handles and sculpts. And I'm going to leave just a little bit of room for I am going to put just a little bit of translucent down, even though it's not that far off. This I almost could get away without even putting any translucent down on this, to be really honest with you, but I want to make sure she has very translucent lining, those transition zones on her teeth, and I want to make sure I hit that. But you can see how just I lightly touch it, and it goes right where I want it and stays there. So I've extended, you can see hopefully that I have taken it a little bit past the bevel. That's what I like to do with the material, and we will finish it to infinity. So just thin it out, thin it out, thin it out there. All right, I'm going to go ahead. So now I'm using the demi light, which really is a very nice LED light. It's really lightweight, fits in your hand nicely, easy to have around your operatory. You don't have a cord. And we just put a nice sleeve on it here, keep it clean, safe between patients. It's got a small footprint of a battery pack, so to keep it charged, so you're not taking a lot of operatory space. It's a nice light. And now I'm going to use just a little bit of the incisal light shade, just the smallest amount here of a second layer. As I said, I probably could have got away with it really with one shade, and that's really was the design of the Herculite Ultra material, was to try to keep simplicity. They've cut down on the number of shades in the system versus the Herculite XRV, so trying to simplify the shades, don't make it so complicated, but still cover your basic shades that you need when you're doing your direct composites. And look at the way wherever I put it, it stays. And that's what I like to see, and I think most dentists like to see when they're doing direct composites. Does the material stick to your instruments? And you can see it hasn't stuck to the instruments. And I put it on there, just light strokes, light strokes. Okay, so you can see, really just put on a very thin layer, second layer there, very thin amount. So hopefully you get a feel for how, simple the system is. If you've taken a composite workshop from me before, many times I'll teach you need to use 2 or 3 shades, and many times I'll use tints. Now she didn't really need any tints here. I think you'll see how this is going to be rather seamless and have a nice chameleon type effect as it blends in from the restoration to the tooth interface. Really should be undetectable, hopefully, when we're done. So I've set that. Now we've taken the orange light off and clear light and take out. Now, if you notice, this tooth was tucked a little bit behind the tooth number 8 before we started, and I've brought it out a little bit, so I'll probably compromise somewhere in the middle. So probably just compromise somewhere in the middle, just a little bit on this. So I'm going to use a disc system. So I'm going to use a disc system at this point, and you use whatever disc system you're comfortable with. So just trying to create an incisal edge plane with that disc. If you notice the angle that I was putting that at, it wasn't at a 90-degree angle, but it was slightly at more of a 30-degree angle to the lingual is really what you're kind of shooting for. That's classically what you want. And many times I'll work on the lingual first, and you'll see I don't have a lot of extra flash, but we just want to get everything nice and smooth and comfortable for the patient so their tongue doesn't catch anything and they'll be able to floss nicely on this restoration. I think you can tell already that it's a pretty seamless restoration there. Okay. Let me see a piece of floss, Edwin, please. So, we should be able to floss. Basically, I took the material right up to the adjacent tooth because that plumber's tape is very, very thin. Very, very thin. Let me have a medium disc. So I've gotten the incisal edge the way I want it, and the lingual pretty much the way I want it. Obviously, I'll need to check her occlusion here to confirm that. In the facial, you'll see how much time am I really going to spend finishing and polishing this. It really won't take that much time, and that's the idea. That was really what Kerr tried to accomplish with this restorative material. Was to make this material something that handled well and was very nicely sculptable and didn't slump, and then also had nice polishability. Certainly the maintenance of the polish is something that we don't have any long-term studies on. That's the only kind of disadvantage maybe, but I think in my hands thus far, it showed a lot of very nice promise here. And you can see my assistant is putting a little extra water on it. So it dry, Edwin? So look at that, really just with a medium disc, what we were able to really accomplish, which is really quite nice sheen to it already. Let me give you just a fine. So all I've done on the facial surface here is taken a medium disc to the facial surface, and now just a fine disc pretty much mirrors the luster of the adjacent tooth, that's what we're trying to do in dentistry. And that's quite a nice shine there. And we can see that at this point, pretty nice, seamless, really restoration here for the patient. I just see a little bit of marginal irregularity that I don't like in this restoration. It's very small, so I'm going to go back to a yellow striped diamond just to get it just a little more flush with the tooth, even though you could see with the Explorer it was very nice already. But I could just see in my loops some irregular surfaces that I just want to smooth up. Little water, Edwin, please. Slow it down. You're going to need to get me another one, okay? Okay. Yeah, give me the one yellow. So I think you can see how we really took this tooth with, certainly a small chip in it, all right? And put a small bevel and then etched and primed and bonded and then placed this Herculite Ultra. And the one thing I didn't point out earlier was that, that I was talking about it not slumping, that you could actually sculpt it and push it where you like it. So the sculptability, I think, is very nice. The fact that it doesn't slump is fabulous, but you also notice that it didn't stick to the instrument. And that's the most frustrating thing, is if you, get the material where you want it and all of a sudden, you're pulling the instrument away from the tooth and the material's coming with it. That's very, very frustrating. And then I think you can see, once I got the margins where I liked them with the red striped diamond, that really I took one medium disc, and I don't really care what disc system you use personally, and one fine disc, and that's really the polish that we got on that, which I think most of you consider very adequate. Let me show you what can be done with this if you really want to have some fun, and you have someone who has really very high luster in their teeth, that you take one of these goat hair brushes. It's a goat hair brush on the outside with a chamois on the inside, and that really will buff this very nicely. So I like to do it first with a little water, just a little bit of water, and then I'll do it dry with the composite polishing paste. And so a little bit of pressure with this initially. So a little bit of pressure with it initially, with a little bit of water, and then I come back, kind of like a shoe shiner almost, and then just I'll lightly kiss the tooth. So, as I said, lightly do it with water the first time with composite polishing paste, and then I like to do it dry on the second time around, and then you can usually get a very nice Okay, so I think hopefully that what I was able to demonstrate here really was how simple this technique really is. So the Herculite Ultra hopefully has simplified things for us, made a material that we can handle nicely, has really the same 25 years of proven technology that we've learned and gained through the use of Herculite XRV through all these years. But now trying to simplify it, make it a little so it handles a little easier in most clinicians' hands, the way that many of the other micro hybrids really handle. A little easier to move around, but does not slump for you, is not sticky. And then try to cut down on the number of shades that we need to use. As you saw, I used 2 here. Probably could have got away with 1, honestly, but I'm a little fussy sometimes. So I hope that you like really a nice polish. You saw I really only used a yellow striped diamond is what I used initially, just to get a little bit of contour, so a yellow striped diamond. And then I went to one medium disc on the facial, and then one fine disc, and that you saw had a nice polish. And now I've come back with just a little composite polishing paste and a goat hair brush, and I think you can see that that's some pretty nice luster there for that restoration, and blends in really seamlessly, which isn't that really what we're trying to do. I think it blends in seamlessly and it mirrors the adjacent tooth, which is really the criteria for a nice direct composite restoration. So hopefully this will benefit you in your practices, and you'll be able to deliver restorations at just a little higher level from this point forward. This is great with this great material, Herculite Ultra.